A live look at downtown Kansas City from our Earth Cam. It has been a long 2 years in the city of Fountains between COVID-19 and the increasing number of violent crimes. But the news isn't all bad. There are also a number of positive changes on the way to improve our health and improve our safety. That's coming up now on the Morning Medical Update. Good morning. It is Friday, June 24th. I'm Jessica Lovell. Thank you so much for being with us here on Facebook, YouTube, and on Twitter. Experts tell us COVID-19 is steady for now. What does this mean for the Kansas City Health Department and the rest of the city? We still track our COVID cases here daily. Dr. Dana Hawkinson will join us with the latest COVID count and how green spaces can help heal Kansas City. We really appreciate you joining us every morning, and we always look forward to your questions, which you can send to us anytime during this update on YouTube, Facebook, Twitter, and you can email those to the Medical News Network. There are the links right there on your screen. Well, barbecue, fountains, and jazz, they all define Kansas City and have since the city's original renaissance back in the early 1920s. And since that time, the city has undergone a lot of changes, from the addition of sports teams to an ever-growing population. But the headlines getting the most attention across the country and here at home: COVID-19 and crime. Our guests today are the Honorable Kansas City Mayor Quinton and Dr. Marvia Jones, Director of the Kansas City Health Department, and we are so glad to have both of you here in person with us today. Thank you so much for joining us. So let's talk COVID first. Dr. Jones, I want to start with you. The latest Missouri sewer shed map shows an increase of COVID virus in the wastewater. What does this mean for the city? What does it mean for the health department? What does it tell us?
Yes, thank you, Jennifer. What it tells us is that the transmission rate is really high right now. The newer variants that are in play are definitely there's a lot of high spread with these variants. However, what we continue to recommend to folks here in Kansas City is to take precautions. We know that we do agree with the CDC's recommendations for if you are high risk or you have high risk folks in your house, meaning they're dealing with maybe some chronic diseases or some other immunosuppressing conditions, that you should consider masks when indoors in public.
So let's talk about masking, Mayor Lucas. I want to talk about what concerns you most as we start to see those numbers kind of creep up. We'd love to see them go away. Never going to happen. Is it time for people to start masking again, or is that just a thing of the past?
You know, I think it's time to be responsible. Something that we've been saying on this show for quite some time now, which is first, make sure that you're not harassing people who are in masks, making sure in our school environments and others, right, people still feel comfortable wearing masks, making sure they're taking important precautions. I don't think that you're going to see large-scale mask mandates again. The politics, the discourse, everything around it certainly has been threatening, but importantly, hospital facilities, places where you're going perhaps into a nursing home, other facilities, it's very important, I think, to continue to mask up.
Well, and it's interesting, you know, when you're out in public and you see somebody masking, I immediately think you must be taking your own health and others into precaution based on something that's going on with you. We don't know, but you're doing the responsible thing for you and others around you. So it's just a different time of masking, it sounds like, right?
That's exactly right. And that's why we want to make sure that we still say, just be kind, respectful to others who are actually taking on these precautions. Make sure that you're not judging negatively anybody who is. And importantly, and I've gone to a lot of schools. I'm heartened by how many students are still looking out for their own health, their parents are, so many others. So make sure you continue to support those practices.
Kids have done it right, haven't they?
Absolutely.
We've been proud of our little kiddos for sure. Dr. Jones, what lessons have we learned though from this pandemic moving forward? What do we want to take with us?
Yeah, we've learned a few things, and primarily that as a public health system or a public health discipline, we do need to maintain closer relationships with our community, even in so-called peace times. Because what we realize is that when there is a disconnect, when maybe our messaging is not easily understood, or folks feel like they don't have much of a connection to us in general, it becomes that much harder for us to get our messaging out clearly and cohesively, and then battle a lot of the disinformation. We also realize that when we do our pandemic planning and we do all of our disaster response planning, we have to really consider the mental health component of that going forward. We realize that sometimes we get caught up in the physical aspects of health, that we so caught up that we maybe forget or give less attention to those mental health components.
All right, let's turn to our COVID count. We do talk about our COVID count daily and keep track of those numbers. Let's check in with Medical Director of Infection Prevention and Control, Dr. Dana Hawkinson, this morning. Good morning on this Friday. How are you?
Hi, I'm good. How are you?
Good.
Yeah, such an apropos topic right now, talking about COVID when we know that the numbers in the health system are increasing, the acute active hospitalizations. Right now we have 24 active with 2 in the ICU and 2 of those on the ventilator. Still 11 in that recovery period, but the 24 active is, it's a little concerning. It certainly is less than where we have peaked in the past, but we know that the trend for the last week to 10 days has increased. So.
I have a couple of questions to ask you about. So what do you make of fertility bracelets and activity trackers that might be able to identify COVID early on? Is this a thing?
Yeah, this is not new at all. We've heard of these anecdotal stories where people 1 or 2 days before they maybe have a fever or sniffles will have these changes on their bracelets that are identified. Later on they'll be diagnosed. I think really what these bracelets are tracking is heart rate, is temperature, things like that. This is nothing new. How practical is it for everybody to be doing that and wearing one? I'm not sure, but again, just a little bit more information that we're learning about. If you do have one of those bracelets, maybe it is a way to track before you actually can feel or know symptoms, maybe 1 to 2 days before that. So.
What about word that Moderna booster is performing well against those newer variants?
Yeah, really, I think what they're looking at mostly is the antibodies that are produced once you are injected with the vaccine. So I think really what we need to be looking at as well as those T cells. Those T cell components are really is what protects us from hospitalization and severe disease. And right now we haven't seen a lot of information that tells us that the spike is changing or coronavirus is changing in some way that doesn't allow those T cells to recognize, because we still have very good T cell immunity. So it'd be really interesting to see what these vaccines now mean for helping reduce hospitalization and severe disease, not just the level of antibodies to any particular variant, i.e. BA4 and BA5.
All right, this next headline, kind of a bummer, but it really goes in line with what we have said from the very beginning, that even asymptomatic COVID-19 among moms, moms-to-be that is, can lead to complications during pregnancy. I mean, making what we always said, they need to be vaccinated, right?
Yeah, absolutely. Early on we didn't think that there was much that was too dangerous about this disease for pregnant women. That is absolutely not true. As we've gotten to be able to gather more data, we found that pregnant women compared to non-pregnant women do have higher risk of adverse outcomes for both them and baby. There was also a recently published study, I think in JAMA Internal Medicine or JAMA Network this past week, looking at vaccination and pregnancy, and you actually do get transfer of those antibodies to baby and through the placenta. So vaccination continues to be vitally important to help protect mom and baby. We knew that there were those misled, misguided, misinformed concerns about vaccination and pregnancy and the health of the baby and the health of the mom, but really getting vaccinated prior to getting pregnant or even during pregnancy is really the healthiest thing for both mom and baby.
Yeah, you've always said there's very few people on the list that should not be vaccinated. Yeah. So we told you at the top of the update how green spaces can help heal the city. We're going to talk more about that just ahead with our guests as we talk and focus more on crime. But first, let's give our viewers an opportunity to ask some COVID questions. Again, get yours sent in if you have any. This is to both of our guests. Amber wants to know, how closely do you all work with Jackson County on different initiatives? Things vary from zip code to zip code, as we know. How does that all work?
Well, I'll start from the political actor side. I know Dr. Jones and her colleagues work very closely through health departments. Throughout the pandemic, we have spent a lot of time talking to folks, really not just at the other counties in our region, but even at our state health departments, both in Missouri and Kansas. That is an ongoing discussion. So anytime that there are new healthcare issues, anytime there are new kind of policy issues, we make sure that we keep those chats going and a strong relationship. One of the things that's most interesting for me is, since I became mayor, we've changed leadership about every jurisdiction around me. Some of our health departments have changed a bit too. And so making sure we at least built those relationships, we continue to have an ability to call each other quickly, has been key to us answering the challenges from this pandemic and many others.
I would imagine the pandemic has in some ways brought you closer, just like it has for so many people in all of their relationships, right?
Absolutely it has. And it made us a lot more candid, right? You work work a lot more quickly in
Yep.
terms of what's happening, and you get an understanding for where the challenges are breaking out, knowing our hospital community around the region, really knowing, I think, when we need to pick up the phone and try to break down some barriers along the way.
Dr. Jones, how do your teams work with them?
Absolutely. Just to add on what the mayor has just stated, yes, the pandemic has really caused us to work even more closely. The contact has increased. We meet very regularly to discuss data as well as what initiative folks are planning so that we can collaborate when necessary. So this is helpful for collaboration and shared understanding, but it also can help us save and share some resources as well, so we're not double spending for similar things.
If you are just joining us this morning, we are thrilled to have Mayor Lucas joining us along with Dr. Marvia Jones, Director of the Kansas City Health Department. So again, get your questions sent in, but we want to get back to a few of these. So Mayor Lucas, we talked about COVID. Now we want to talk a little bit about crime. We've read that headline about the deadly shootings, ongoing violence in the city. According to the FBI, Kansas City, Missouri has a crime rate of 56 per 1,000. Do we know what's driving that rate? How do we get it down?
Well, I never want to be too controversial early in the morning, but this show has taught me the way.
Yep.
And so, what I will say is very simply this. We have a lot of guns on our streets, a lot of guns in the hands of people who are not responsible gun users. When you talk to, actually one of the most interesting conversations I've had was with a neurosurgeon at an area hospital who was talking about how the nature of his practice has even changed over the years from the number of gunshot victims with whom he's dealing regularly. And those are hospitals in Kansas City, Missouri, Kansas City, Kansas, increasingly throughout our region, both in homicides, accidental shootings, suicides, and so many others. And so I think step one that we have to realize is that we have a problem. We need to make sure that we're addressing safe keeping of your firearms if you have them, making sure that if you have guns in the home that there's proper training, security for them to make sure they're not getting into young people's hands, and more than anything that we are deterring the carrying of firearms in places like entertainment districts in Kansas City and other areas. Dr. Jones, who's more of an expert in this area by far than I am, would also note that there are a lot of systemic issues, and we don't just say that because it's a big buzzword, but prevention is an important part in making sure that we avoid our long-term gun violence problem.
And understanding exactly what that means. Help us understand that better, Dr. Jones.
Yeah, so thinking about the experiences people may have had in schools, we know that there are some very real experiences that contribute to people maybe not graduating from high school. There are some factors that increase the likelihood that they will not have that option, and it decreases their ability to earn a good lease or decent living into adulthood. There are issues of systemically disinvested neighborhoods for, decades. That maybe haven't received the same investment that they needed in order to ensure that the families there are able to have a healthy environment. So those are just a few of those factors.
So a lot to take into account.
Yeah.
I know you don't want to get too political.
Sure.
We don't want to dive too deep into it, but it does feel like a lot of roadblocks get put up along the way to try to make that happen. How do you manage that, and how do we even begin to help make Kansas City a leader when it comes to fighting back against this?
I think step one, we become realistic about the concern. I think we share with people that this is a wonderful city, a World Cup city, right? So many things that are going great right now. We fundamentally need to address this issue. And so I think that is working with people across the aisle, frankly. I commend the United States Senate, for example, including the senior senator from Missouri, Roy Blunt. We represent different parties or come from different parties who helped, I think, invest in a better mental health framework that allows us to have responses, red flag laws and others that help us make sure that if there's somebody who's purchasing firearms but who has demonstrated, past propensities that may be a challenge for them, that there's a longer background check process. It's those sorts of things that get us a start. There certainly is a law enforcement answer, and we work with them too. I was with the Kansas City Police Department yesterday and looking at those issues, but I think you have to just be real about it. And another thing that's important, you have to talk about it. You have to recognize that it is something that makes a difference. That neurosurgeon conversation I had was in a very nice neighborhood where we're just hanging out one day.
And you probably wouldn't have expected to have this conversation.
I did not, right? We usually talk about vacation, whatever else is going on in the world. We usually don't talk about that very real issue. I think it's important for us to recognize the issue, not so much from a Kansas City's a terrible place, but instead, how can we fix it? One just brief thing that I think I've seen us do well in connection with opioid addictions, other issues. I have seen more health departments, and I give credit to the Clay County Health Department, the Clay County Sheriff up in the Northland, that are spending more time talking about dangers of even fentanyl and narcotics now. Awareness goes a long way to making sure we address some of these challenges, and I think we should do that with the gun issue as well.
So a lot rests on your shoulders, both of your shoulders, because you're in a position to be able to make those changes. But how do the rest of us, just regular Joe, and Jane's on the street, boots on the ground, grassroots in our neighborhoods. How do we help support you in getting that message out and like you said, opening up those conversations? What would your suggestions be?
Recently there was a study that said that more youth these days have lost a loved one to COVID-19. They lost an elder parent or a grandparent. And so we know that in many communities, the grandparent is the solidifying force in a household. And so what we have right now are a lot of young people who may have lost grandma or the auntie who was caring for them. And so we know that depression is a key thing that folks are dealing with right now. And so I would just encourage all of us to be more vigilant of the young people who are around us, people who may be in pain. Look in and look out for each other. I know that sounds sort of cliche, but that is really a big part of what our response is right now.
It's not cliche because it really just takes reminding. I think we all have it in us, but it's just, oh, okay, I'm going to do that. Or I know somebody who needs some extra attention. Great advice. What's your advice? What's your candid advice for us today?
You know, on the two different issues, guns and COVID, and I'll speak to this too. One, lock up your guns. Keep them somewhere safe. Don't drive them to Arrowhead Stadium where we have a rash of thefts in the parking lot, right? Very simple, common sense things that thousands of people seem not to do. So that's one step there. On COVID, don't be a meanie. What I mean by that is, and I could use stronger language, but nonetheless, right? If there is someone who's wearing a mask, who's looking out for themselves, who's doing any number of things, there's no reason for mockery. You know, I was at the World Cup announcement celebration, and there was a gentleman who was near me wearing a mask out in this big crowded area. And I know that there were some folks who actually made fun of him as if we're on the schoolyard playground and are 12 years old. Be adults, be reasonable, help people look out for their own health, and importantly, still look out for yours. If you're sick, if you have certain conditions, don't just go to the big crowded concert or meeting hacking all over everyone, which is something that during the last 2 years I enjoyed not having to deal with, but it's kind of sneaking back.
I like your terminology. My daughter asked me last night, what's a jerk? And I said, well, it's kind of it's like a meanie. It's a meanie. I mean, I said, so that's a word I can get down with. I get it. I think it describes a lot of things. So Dr. Jones, and you kind of have talked about it a little bit, but so we see this, shift in health, but now focusing on violence with your department. Let's talk a little bit about how you get involved specifically, the health department, what role you've now kind of shifted to encompass violence.
Yeah, I would say the movement in public health towards seeing violence as a public health issue has really shifted between the last 10 to 20 years, and thankfully it is in Kansas City as well, where we really think from an approach of how do we figure out what can be done upstream to prevent crime. A lot of times when people talk about violence, they talk about find the kids, find the people who are doing it, and figure out how to put them away. And so we know that will get us so far, but it won't get us the whole way. We have to get to the point where we are looking at the conditions we've discussed earlier, and we're looking at what we can actually put into the environment, increasing awareness, as the mayor's discussed, really reaching out and giving regular community residents the tools that they need to reach out to each other and get ahead of some of the things that we're seeing.
So let's talk about something positive that's happening. I want to hear all about it. You got the scoop, I know. So before we went to community questions, we talked about the power of green, a green solution to health and wellness, including curbing violence. That green refers to more green spaces. We want to give you a live look right now along I-670 at Baltimore, where a proposed 5-acre park is to be built. It's called the South Loop Link Park, built over I-670 from Wyandotte Street to Grand Boulevard in downtown Kansas City. Mayor, did I get that all right? Are those the right stats? Okay, we want more info though. So what can you tell us about the project? Let's just jump in and get to the guts of it.
Well, a few things. First, I think we recognize that more green spaces in the core of the city are a vital part of building out our not just our transportation network, but really a better quality of life for Kansas Cityans. And you're seeing this in more major cities, that they're trying to reclaim more green space in downtown areas. It is good for your health. It is good for the environment, frankly. It's good even for heat that's projected, any number of things. And so this project is something where it's a good public-private partnership. A lot of the business businesses nearby, Downtown Council, the City of Kansas City, and so many others have been a part in saying, let's try to make sure we're enhancing this park space. And I will note, importantly, this is part of a whole trend throughout the City of Kansas City, where we're trying to make sure that we take more assets into becoming a greener city long term.
Well, I just can't think of any drawbacks of having this project here. $160 million project, though. How's that being funded?
Well, you just named the drawback.
Exactly. When it comes to money, right?
Everything costs, but largely funded through our lead is federal investment. There are substantial infrastructure dollars coming in right now. And by the way, we have those requests for other parts of our city too, 71 Highway Corridor and beyond. But the hope is a largely federal investment mixed with good private investment. The Lowe's Hotel has pledged $5 million, other business owners nearby showing their interest in something that can really be transformative to Kansas City long term.
All right, so it's called the South Loop Link Park. I don't think anybody's going to remember that. You think that's going to change?
You know, I think it changes. I know Senator Blunt's been helpful in it. There are other folks. It could be shortened substantially. The one thing I will tell you is it will never be called Quinton Lucas Park.
Are you sure?
A lot of people might get mad about that.
I think so. Okay, so you talked a little bit about the wellness and the green space, the environment. How does it help fight crime?
You know, immeasurable ways. You know, I'll let my expert talk in a minute, but here's what we see time and again. And for some of us who live in Kansas City or in other areas, you realize often the crime isn't that far from you. What's the difference between a mile in one way or another? Often they are simple things like lighting, activity, people who are walking around, investment in the spaces nearby, right? Folks that actually are calling a neighborhood watch line or 911, right? It's that sort of engagement.
That pride in where they live.
That's exactly right. And it's people that help you feel safer as others are around. And so that's what we're trying to do in more Kansas City neighborhoods. And so it seems somewhat counterintuitive. So much of our conversation, as Dr. Jones notes, has been for years, well, we build a bigger jail or bigger police departments and everything else. While certainly corrections and enforcement have a part to do with our very real problem, the type of city you have, believe it or not, makes a difference. And if you drive around Kansas City, in our region, you kind of see it, right? Neighborhoods that have things that are kept up without illegal dumping, with good lighting, with so much more, often are safer as compared to areas that don't.
Dr. Jones, what can you add to that?
Yeah, absolutely. These green spaces provide opportunities for physical activity, a place for people to take their kids, just enjoy a time out. And it also calms some of the stress in the environment. We've got cars, we've got hustle and bustle of downtown. This really does a lot for our mental health.
I just want to ask you, Dr. Jones, how can the community come together to not just help the victims of these crimes, but the people who inflict these injuries and the trauma on folks? How do we bring them into the fold?
Yeah, I think there's been a lot of good work in the restorative space. And so folks who have maybe gone to jail already or prison for different crimes, physical crimes they've committed, there has been some work in bringing them into contact with the families that have been impacted by their acts, and then helping them to basically hear from them as to how they've been harmed and to form some sort of reconciliation there. That's one item. But also, again, I have to, as a public health person, I have to go back to prevention. The old adage that hurt people is still very alive and well. And so the more that we as a city can continue to reach out to folks who are hurting, who feel displaced, who feel like they have lost everything that is important to them or close to them, the earlier we can get to them and be on the lookout for them, the less likely we'll need to respond to something afterward.
Well, and you answered the question that I was going to ask you next, but I kind of want you to reiterate it, because the impact of crime on kids, it can be really devastating, and you talk about prevention, but how do we help them? You mentioned again, just opening your eyes, being aware of who's living around you and who your friends' kids are, your kids' friends are, and having those conversations. Todd, just talk to us more about that.
Yes, one of the things we're talking about is how do we become a trauma-sensitive city? And what that means is basically wherever you go in our city, whether you're at a hospital like here, or you're at a school, or you're at the health department coming in for your kids' immunizations, how do we all change the way that we do business in a way that doesn't increase harm? So maybe doing things so that folks don't get a runaround when they're seeking services, doing things to make sure that we're using plain language that everyone understands. All of those are things that will help families feel supported and reduce the amount of trauma. We know that the buildup of trauma over time is what can cause some of the bad outcomes that we've been seeing.
I want to get to some community questions, but I want to first see if we have any reporters on the line. Let me know. No reporters, so I'm going to ask a question. Alex wants to know, if you move crime out of one area, where's it go?
You know, I think that's what we're trying to change.
Okay.
We used to just move it from one place to the other. So we said, you know, hey, if people are causing trouble here, we'll move them 10 blocks away. We are trying to fundamentally change that. One example, you know, let's say youth. We used to have a thing of youth congregating in certain areas of Kansas City. We're trying to engage them in more activities so they actually have something to do. So you're not just running them off from the movie theater and then having them go to another spot. Instead, you're saying, all right, hey, is it summer basketball? Is it something else that gives them that level of engagement?
Yeah, engaging them at the moment.
Our goal is to actually bring it up, and I will bring this point up, and I say it all the time as to why I think Kansas City can change. In 1990, the city of New York had about 2,500 homicides each year, right? By now, it's gotten down to about 400, and that's actually inched back up. But that tells me something. If they can reduce that number so dramatically, that tells me that we can too. It doesn't just mean that those homicides move to the suburbs or go somewhere else. It means that you can change your community fundamentally, and I'm committed to us doing that.
Dr. Jones, what can you add? What do you hear from folks out in our city?
Yeah, I hear that when we do actual things that change the experience that people have, you're not just moving the crime. So if we all become this sort of trauma-sensitive, trauma-aware city and really monitor our processes and the things that we're putting into place, it shouldn't be moving the crime anymore.
This is something we want to always highlight on our program, but Erica wants to know, what impact do healthcare disparities have on crime? You mentioned access, but let's talk about that a bit.
Absolutely. So that we know that, excuse me, we know that some families have more interactions with the healthcare system than others. We know that when we look at some communities, they have historically higher rates of things like diabetes and kidney failure and hypertension, all of those things that we know hinder a loved one's ability to really care for their family, to be there for them, to be really aware of what's going on with their kids or monitoring the experience they might be having in school, for example. And so we know that the inability to be healthy and physically healthy affects your ability to be mentally or emotionally healthy as well.
I've got a couple of questions coming in, Dr. Hawkinson, for you. A lot of people wanting, they're saying that they have been vaxxed and double boosted, but they're still getting COVID. Can you talk about the protection against severe disease being the focus now?
Yeah, I mean, I think we have been doing that for quite some time on the show with Dr. Stites. You know, again, there are really no vaccines that protect against infection. So that is where we need to start. Vaccines are intended to protect against disease, particularly severe disease. We know that these vaccines continue to do that very well. This is what we will be looking at, or what the FDA will be looking at also with the new vaccines that come out. You know, we know that Moderna has put out the press release saying the antibody levels for BA4 and BA5 are higher when we use this vaccine. But really, we also want to know what is the efficacy and the protection against hospitalization and severe disease. And these vaccines continue to do that even throughout all the variants that we have seen. So they still provide very good protection against hospitalization and severe disease.
And then Isaac wants to know, is it just me, or does it seem like the numbers are going up more slowly compared to previous surges? Will it peak lower due to greater immunity now with people getting vaccinated?
Yeah, you know, I think Isaac's right on. We have seen overall this current surge, if you will, of BA2 and BA4 and BA5 for quite a few weeks, but we haven't seen that significant increase in hospitalization. So I think he's spot on. I think it's due to a combination of factors. Most important is probably that individual immunity that people have gained from vaccination or infection or both. Hopefully we will continue to see that as time goes on. We know that cases actually that are reported have really seemed to plateau a little bit, but we really haven't seen that sharp increase in hospitalizations that we have as we did during the other surges. It certainly has been slower. The overall rate of increase is quite less than it was in the previous surges as well.
And then just lastly, Joellen has a question. I don't know if you've had a chance to read this article from the New England Journal of Medicine, but it's an article that shows a study that natural immunity is better than vaccine boosters for COVID. What do you know about that?
Yeah, I've seen a few about that, and I don't think that's actually true. And again, what are we talking about? Vaccination. Was also just looking through an article in Cell yesterday, which actually looked at 4 different vaccines and vaccinations. So the 2 mRNA platforms, the Johnson & Johnson platform, and then the Novavax, and then infection. And really what they saw from that is that you have very similar, depending on what component you're looking at, B cells, T cells, very similar results for all of those things. So I'm not sure that it's better. What we have always said is that immunity through vaccination is going to be safer, because whenever you get infected, you never know what will happen, especially in those times that were when the vaccine was first rolling out, and if you hadn't been infected yet. So again, I think we have to define what is better. But when we look at the cellular level of the immune system, we see that you have very good immune responses, both in those B cells, T cells, with all the vaccines, and you have it as well with immunity. But the safest way to immunity has always been through vaccination.
Yeah, I think we're hard pressed to ever get you to say people should not vaccinate and rely on natural immunity. It's certainly at this point. We're going to wrap up here in just a moment, but I want a little story time just about what it's been like professionally and personally for the last couple of years. I was driving into work thinking, God, it just feels like so long ago that we got into this pandemic. It feels like yesterday, then it feels like so long ago. So, Mayor, I'll start with you. You get into office, ready to, push through some initiatives and get ready to fight for the city, and then this pandemic hits. What's it been like for you?
I still remember February of 2020, the Chiefs Super Bowl parade. I'm leaving it and thinking, man, this is the greatest job ever, right? I'm mayor for a few months, Chiefs are winning, all of that, and the world changes a bit in March 2020. And like many others, you experience it both in your professional position, but as a human being, wanting to protect your parents, wanting to protect your family. I had a child during the pandemic, as many others did, and wanted to make sure that they were safe, that my wife was safe throughout it. So there was great stress. There was great responsibility along the way. I watched Dr. Hawkinson and Dr. Stites every morning, like a lot of other people in this region did. And I think it was this big goal of ours to just make sure you're getting out truthful information, a push back against misinformation. And it was the hardest in 2020 when you didn't know everything. But I think just trying to say, hey, we're giving you the truth as we know it, things will get better. And just keeping your head down sometimes, knowing that there was a whole bunch of noise outside of you, was probably the most important part. One final point, I agree with Dr. Jones in the sense that the impact on our young people has been challenging. And so making sure we take the opportunity to try to talk to them, work with them, build them back up, to me is so key.
Well, I was just going to say, what kept you up at night? And I bet you that was exactly it. I used to think, gosh, how are kids that are supposed to be in school eating? Where are their advocates, their coaches, their teachers? The one person maybe a day that gives them a hug, maybe the one meal they get a day. It was really, it's easy when you're mayor or you're me or you're you, but it's really tough. So you're saying that being mayor is not just one big Super Bowl parade?
I would love another one, but we're trying to get back to that, but no.
Dr. Jones, what's it been like for you and your department and in your life?
Yeah, one thing that I'm hearing from folks is that this has been so hard on the folks who, especially those in the health department who are actively on the ground, fighting disinformation, being out there doing the clinics everywhere throughout the city so that everyone would have access to the vaccine. People are really tired. A lot of our public health force has left, decided that they want to do something different. This is nationally. And so what I've been really focusing on at the health department is how do we build these folks back up? How do we give them a break? How do we figure out how to pour into them while we're at the same time trying to implement strategies that will address any gaps we identified during the pandemic? So that's where we are. It's interesting. I think, we've seen tears. We've seen people kind of vent. And I think that we are on a real process for healing right now.
Well said. Before we get out, just any final quick thought that you want the community to know as we head into the weekend, Mayor? What's your final message?
Things are good and they're getting better, right? There's reason for optimism, and I know if you watch the news, it doesn't seem that way, but we're back around each other. We're supporting our local businesses. I think things are in a good trajectory, and more than anything, just share the truth, right? Just make sure we're sharing, I think, the truth about things and looking out for each other still. You
said exactly what I was going to say. It feels good, but make sure you're really looking around you.
Absolutely.
Keep your head on the swivel. Just a final thought from you. What do you want us to know?
Yes, better days are possible and they are ahead. There are things we can do. We're not helpless in all of these things. And so that makes me go to sleep a little bit better at night.
Nice to see both of your faces, not with a mask on.
Right.
And here in our studio. So please come back and visit us.
Thanks
Promise?
so much.
Yes.
Absolutely.
Great. All right, Dr. Hawkinson, final thoughts from you.
Just want to echo the messages by our guests and hopefully everybody stays safe in more ways than one, and looking forward to a good weekend. So.
Yes. And thank you all so much for being with us today. Don't forget you can catch our updates anytime by logging on to Facebook, YouTube, and Twitter. So go out, please make it a great, safe weekend. We'll see you back here Monday at 8. Did you know 1 in 4 cancer survivors struggles to pay their medical bills? I'm Jessica Lovell. Thanks to inflation, many are facing an even tougher diagnosis of struggling to pay bills and getting their treatment. The help available Monday at 8.
Subscribe to our morning medical update and open mics with Dr. Stein's podcast. Now, everywhere podcasts are available.